Does a person who is affected by frozen shoulder remain permanently weak throughout their life?
Okay.
Hmm.
I think I've seen the problem the last 6 months. I've seen more frozen shoulders than I've been seeing the last probably 5, 8 years since I've been in India now.
Okay.
I think the work related to probably the work and everything. Frozen shoulder as such is that's a common term, it's a colloquial term, and the medical term is adhesive capsulitis. That means the muscles around the shoulder joint they get stiff, and as a result, movements are restricted. And that's the most important thing.
Mhm.
What people do not shouldn't worry about is it's not a permanent disease. It's a self-limiting problem. That means over a period of time, things will improve.
Mhm.
The only drawback is how long will it take for me to get better? No one can give an exact time frame, but usually it's from 6 to 12 months is a common time frame. If you look at frozen shoulder, there are 3 stages in it. First stage is called as a freezing stage,
Mhm.
where you start getting severe pain when pulled up, especially mostly at night. People cannot sleep. Second stage, what happens is you have the freezing stage becomes frozen. That means the muscles around the shoulder joint they get stiff. The pain starts slowly coming down. The third stage called a thawing phase. That's the stage where the muscles slowly start recovering back and they get the movements back. What has not fixed it, what we tend to do in these cases is first and foremost to give them pain relief because pain is a major part of it. Uh, because of pain, people do not use a shoulder and that shoulder starts getting more stiffer. So what we tend to do is we give them pain relief and then advise or encourage them to do physio or rehabilitation to keep persistently regularly moving the shoulder. And as over a period of time, slowly pain will get better and the shoulder starts getting.
Okay.
But there are a few risk factors for this. Diabetic patients have a higher risk of getting a capsulitis of the shoulder, and it's usually seen after an injury or some small injury can of the shoulder. You might have just pulled something or lifted some heavy object, and that causes a muscle strain, and that probably leads to trigger factor, and that causes this adhesive capsulitis of the shoulder.
Okay.
I think the main thing the patient needs to know that it's not a permanent disease. They will regain most of the function or nearly 100% of the function should return back, but usually it takes time. It doesn't happen within a week or two. I tell patients normally will take minimum of 3 to 6 months.
Okay.
Some people have last up to.
So I think the main thing is to understand first, I mean, get the symptoms right and come to you as soon as possible.
Exactly.
Okay.
Get it soon and get it treated as soon.
Okay.
If you do not get it treated, if you just leave the shoulder as such, it's going to get more stiff. Then the stiffness causes the problem with stiffness is that if you do not use a muscle or a joint for a long period of time, one, the muscle gets wasted. That's the main problem. Second, the bone again, if you do not use a joint, the bone becomes weak. So movement is very essential. So I think that's what we try to encourage the patients. In spite of the pain, we try to give them pain relief, then start moving the shoulder as much as possible.